Hello, Dr. Talorico. I'm going to talk about some blood tests for cardiac risk. And so this is one of the things that people ask me about a lot: which blood test should I get? I really like a test called the VAP. The VAP does a more exact measurement of cholesterol, the low density lipoprotein, the high density lipoprotein, but also evaluates something called lipoprotein A, which is a subfraction of LDL. Lipoprotein A levels are really very strongly associated with cardiac risk. So that's one thing I really like to know. I want to know what the homocysteine level is, because this can be a highly inflammatory, very toxic chemical that accumulates, and it's mostly due to some imbalances or low levels of B vitamins. So it's something that can be readily changed, as is lipoprotein A. I like to look at C-reactive protein, and that's because it talks about inflammation. It gives us a guideline as to how much inflammation is going on inside the heart and inside the vessels. And we think that really heart disease is really an inflammatory disorder more than anything else. And because of that, we also want to evaluate something called interleukins. And interleukins are basically parts of your immune system. So if you have a really reactive, a high level of interleukin, like interleukin 6, that means that you probably have a great deal of inflammation going on in the body as well. The other things that are pretty typical, triglycerides, and that's just basically the body getting ready to store some fat. So you have some fat in the bloodstream that's being ready to be stored. And this could also be high for other reasons like pancreatitis. We want to know blood sugar. Blood sugar is sticky. So if you have high blood sugar, the chances that it's sticking to the vessels, that it's causing a problem inside your circulatory system, are way higher. So we want this to be normal. Fibrinogen, and so if you have a real high fibrinogen level, this means that you're more likely to develop some type of a clot. And since many heart-related issues are clot-related, this is something to know. And then again, because I like to know what's going on, the dynamic between blood sugar and insulin, I also suggest that you get the insulin level checked, because that's going to give us some good information as to what your metabolic status is. So your blood sugar may be normal, but your insulin level is high, you have a metabolic issue going on, and it just hasn't manifested or hasn't completely shown up to be diagnosed yet. So this is a good place to go. If you ask for that VAP, one of the things they're going to evaluate is your LDL, but they're also going to tell you about the particle size. So we want particle size of the LDL molecule to be big and bumpy, not small and dense. Small and dense is bad because it penetrates into the endothelial lining of the vessel and can cause some problems, some heart disease related issues, some clotting and things of that nature. So we want these particles to be big. Okay, so I have a portal I set up for my patients, and you can get onto that portal and order tests, and you can order tests for yourself, or you can just look at the tests that are available. And this is something that you can do for your own health. Even if your doctor doesn't want to order the test, you can do it yourself. So, and then keep records of everything, keep progress over time so you know what's the state of health. And then by knowing these things, you can make better informed decisions rather than just waiting for the doctor to tell you what to do. You can be more proactive in your own health. Okay, thank you.